Preeti Sharma. I'm MD Pathology and I studied from Delhi. I've done my MBBS followed by MD from Vardhaman Mahavir Medical College and Safdarjung Hospital in New Delhi. So, in fact, that's one of the places nowadays, one of the hospitals which is, massively loaded with the COVID cases as well. And after completing my MD, I've done my senior residency from the same hospital. And currently, I'm working with a private lab in Delhi itself. So, guys, pathology is a subject. I know it's the subject which always reminds you of just two colors, that's pink and blue. And it's a subject which probably troubles you twice in your lifetime. One is during when you have to clear your university exam, and secondly is when you have to write this particular paper. So, the MCI screening exam, correct? And later on, of course, when we talk about the future, you have your entrance, PG entrance to give. So, that is another story altogether. So, guys, what do you have in pathology? If I have to give you a brief outline, you have three aspects of pathology that you have to deal with. Number one, you have general path. Number two, you have systemic path, which has all the various cardiac, respiratory, vascular, GIT, kidney, all the systems involved. And number three is hematology. So that is how we always divide path. And under path, how will we be studying path for the upcoming exam? There are two aspects. See, theory is obvious that you have to target. Other than theory, there are two aspects you will have to target. One is the MCQ. So because MCQ practice is a must. So time and again, I will keep on putting forward few MCQs and few revision questions to you. That will be something that will be a routine as you will see within these lectures. And you will have to focus on images. Now, there was a myth up till now that images are only a part of pathology for the PG entrance exam, and images are not something which are very important for the MCI exam. However, if any of you appeared for the December exam, and or if you have seniors and if you've taken their review, then the December exam had certain, it was quite heavily loaded with images. So images no longer can be ignored. Not only path, but most of the subjects had images in them. So you have to focus on that. So these are the three aspects of pathology that we are going to focus on: general, systemic, and hemat. Obviously, the major chunk of the paper comes to you from general path. I would say 60% of your pathology is done if you've done general path. And what all does general path include? So yes, all throughout, it will have a lot of images, and I'm sure all of you are already familiar with this platform. You already have had classes earlier with Dr. Siraj, so you know how the platform works. After that, there is an option of downloading the PDF as well. So all the images that I'll be showing you in class, they are within this PDF, and you can download that PDF, and obviously you will have all your images at one place. Next, what you need to focus on, as I said, general path. So that forms 60% or your chunk of your subject. And these are the five topics that we are going to cover under general path. So nothing that you have to write up till now. These are the five chapters, and that's the same order in which I'll be teaching you the chapters: cell injury, inflammation, genetics, neoplasia, and immunity. So these five chapters should come to you as it is when you're talking about general path, when we're talking about general path. So 60%, I repeat, of your paper is done if these topics are done. And that's exactly how I'll be starting today. The first two aspects. So today, first class is from 9:30 to 11:30. So this I'm going to start off with cell injury, the first topic and the basics of pathology. So guys, without wasting any further time, I guess we can start with the topic. But before I start, there are two things that I want all of you to tell me. First, I'm creating a poll because I want you to answer something for me, that there are some students who usually do not make notes, and there are some students who are making notes side by side in the class. So obviously the pace of the class varies according to that. So quickly tell me, guys, would you guys be making notes side by side while listening to the lectures? Is that what all of you are planning to do? I've put up a poll. Let me know a yes if you would be creating or if you're making your own notes, because then I would give you sufficient time to copy down your notes as well. Okay, great. So as I see, majority of you, 92% of you would be making your notes side by side. So I'll take care of that. And secondly, I'll proceed. Just give me a quick thumbs up if the audio and the visual is clear. If there's no lag, there's no issue with that. We can easily proceed. Great, guys. So, as I see, no issue with the technical part. So, let's proceed without wasting any further time. Hi, Dr. Brijesh, welcome. So, guys, when I say cell injury, don't copy this down right now. I'm just giving you an overview of the chapter. What all are we going to cover? We will cover number one, reversible cell injury. You know that. After that, we are going on to that, we'll cover irreversible cell injury. Then we'll go on to cell death. These are the different types of cell deaths that I will talk about. So, first, the injuries. After that, the cell dies. So, cell death. Thereafter, we'll talk about a topic called cellular adaptations, intracellular accumulations, cellular aging, and free radical injury. So, that is what we are going to cover all throughout. Dr. Deepu, yes, today obviously it's not possible to finish entire general path in the three sessions itself for today, but today we will be doing general path only. So as I said, we are beginning in order. So we'll do cell injury, then we'll go on to inflammation and so on. Okay, guys, so let's begin with the very first thing. Before starting cell injury, I'll be talking about four one-liners. So the first one-liner is, what is the most common cause of cell injury? The most common cause of cell injury is hypoxia. Excellent. I was expecting that answer from all of you, and that's correct. It is hypoxia. From here, the examiner asks you question number two. So the most common cause of cell injury is hypoxia or a decrease in oxygen. Why has this oxygen decreased? So this oxygen has decreased because of, what is the most common cause of hypoxia now? What is the most common cause of hypoxia? It is ischemia. It is ischemia. That is when the blood supply has been cut off. When the blood supply has been cut off. So these two one-liners are clear for you. Now, after this, they will ask you which is the cell or which is the organ which is most sensitive to hypoxia. The organ which is most sensitive to hypoxia. So these are the two questions. Yes, great guys. I get the correct response from you. The organ or the cells are the neurons or the brain, whatever you want to call it. So the cell which is most sensitive to hypoxia is neurons or the brain. When I say most sensitive, what do I mean? When I say most sensitive, I mean that, if you expose the brain or if you expose the neurons for a very short duration, say roughly 3 to 5 minutes of hypoxia, the cells begin to die. So it is extremely sensitive to hypoxia, number one. Make it a habit whenever in any subject you do something most sensitive or most common, go to the other end of the spectrum. Do least sensitive or least common also. So the cell which is most resistant to hypoxia, or in other words, can I say the cell which is least sensitive to hypoxia? The least sensitive. Dr. Sharath, you're right. The cardiac muscle or myocyte is resistant. I would not deny that it is resistant, but I'm asking over here the cell which is the most resistant in this list. And the answer to that question is a fibroblast. Excellent, Dr. Rajesh and Dr. Himani. The answer to that question is fibroblast. So, four questions done for you. Quick revision. Question number one, most common cause of cell injury is hypoxia. Question number two, most common cause of hypoxia is ischemia. Next two questions, cell most sensitive to hypoxia are the brain or the neurons. The cell most resistant, like even for 50 minutes, for 60 minutes, if hypoxia is carrying on, this cell will be standing, the last man standing in your body. This is very resistant to hypoxia. That is a fibroblast. I hope this is clear with everyone, because if you're done with the one-liners, now let's proceed with the actual chapter. So remember the topics that I told you, the first topic that we will have is reversible cell injury. That's the first topic that we are covering, reversible cell injury. So there's obviously going to be a flowchart that we will form. And I thought that, the most common cause of cell injury is hypoxia. So let's begin with that only. Let's begin with this cause only, hypoxia or decrease in oxygen. So for the students who are joining in right now, we've just started with this chapter, so you can start taking down notes. You just missed out on one or two slides, so that's not much. Hypoxia or a decrease in oxygen. Now remember, go back to your school days. We used to study that oxygen is very important for ATP production. And obviously, everyone knows that one famous line, the powerhouse of the cell. Who produces ATP for us? The mitochondria, right? So, can I say no oxygen means the mitochondria will get affected? So there is mitochondrial dysfunction. That's the first thing that you have to know out here. There will be mitochondrial dysfunction. And what do you mean by mitochondrial dysfunction? Anyone? ATP production is going to get affected. So there's going to be a decrease in the ATP production. So the powerhouse of the cell is affected. This brings you to question number 1 for your exam. They will ask you, what is the first change of cell injury? The first change of cell injury, and you remember that is mitochondrial dysfunction. So you've done the first MCQ already. Because of which, what happens? ATP production is going to go down. Now, please remember, because of the decrease in the ATP production, now there are three things that are going to happen. Three things of a flowchart that I'm going to tell you. So if everyone has copied this, let's proceed. And I hope everyone is in sync with this first MCQ that we've done. Okay, moving on. Now, guys, whatever happens in this flowchart here onwards is because we are in an ATP deficient state. We do not have ample ATP. Everyone in physiology, have you heard of sodium potassium ATPase pump? Everyone's heard of that? So that's the first thing that I'm going to target on. In this flowchart, that's the first thing. Now, guys, so the first thing, I'm taking the flowchart one by one. This is the first aspect of the flowchart. The word itself tells you sodium potassium ATPase pump will need ATP, but our body is now in an ATP deficient state, right? So, can I say the sodium potassium ATPase pump has failed? Failure of the pump has happened. So, let's do something. Let's draw a pump. First, let's draw a normal pump and then we'll see what happens when this pump fails. So I'm sure all of you know the pump very well because you have studied this under physiology. In a normal pump, there is going to be efflux of 3 sodium. So 3 sodium exit and 2 potassium enter. 3 sodium exit and 2 potassium enter. And obviously this requires ATP. So sodium, potassium, ATPase pump. Now common sense guys, basic maths. Where is the amount of ions more? Is it inside the cell or is it outside the cell? Where is the concentration of the ions more? Inside the cells or outside? Obviously, basic maths. Concentration of ions is more over here. Guys, this was the normal pump. Now I'm talking about a scenario where the pump has failed. So failure basically means whatever you were doing, make it opposite. Reverse it out. Okay. So now what is going to happen? 3 sodium will start entering. 3 sodium will start entering and 2 potassium will exit. Now, guys, where is the concentration of the ions more? Now, is it inside the cell or is it outside the cell? Is it inside the cell or outside? Yes, it is inside. So, guys, can I say that if the concentration of ions has become more inside the cell, it will tend to pull water? Why will it pull water? Because obviously solute concentration inside the cell means for compensation, it will pull the water inside. And that brings you to a very important change. What is that? If water enters the cell, what will happen to the size of the cell? The size of the cell will increase. There is cellular swelling. And yes, all of you are correct. Perfect answer. Why is the cell swelling up? Because water has entered. So can I say, guys, can I say this is hydropic change? Can I call this hydropic change? Right? This brings you to a very important question. Question number 2. What is the first morphological change of cell injury? What is the first morphological change of cell injury? Now, please remember, there were two questions, just one word has changed and your answer has completely changed. What was the first change that I told you some time back? The first change was mitochondrial dysfunction. But if I now say which is the first morphological change, your answer has changed to hydropic change. Guys, before I proceed, have one basic concept. Morphology. In this subject, when I say morphology, I will mean basic things like size of a cell, shape of a cell, how the cell looks like, right? So when I ask you first change, just this much, the first change in a cell is the mitochondrial problem. But if I ask you the first morphological change means related to the size, the shape, so on, then your answer will be the size has increased, cellular swelling or hydropic change. Is this clear with everyone? First change has happened, hydropic change is done. Now let's see, still more and more water keeps on entering the cell. So number one, you said that there was cellular swelling. Now further, more and more water enters the cell. It enters the endoplasmic reticulum. So you call it endoplasmic reticulum swelling. So first, water entered, the cell increased in size, water kept on entering, the endoplasmic reticulum also ended up swelling up. Still more water is entering. Now what will happen? Do you notice there was a nice round cell earlier? But guys, our body tries to protect us till the very last minute. Although injury is happening, but your body will stand with you till the very last moment. No, not apoptosis, Dr. Parthiban, right now, not apoptosis, but I'll tell you when that comes. So can you see that firstly the cell was nice and round, but now water kept on entering. So the cell tried to increase the surface area. What did it form? It formed cytoplasmic blebs. These projections that I have drawn out here, cytoplasmic blebs. So in order to increase the surface area. But now, after some time, your cell will give up that, I cannot accommodate more water any longer. So, can I say that some damage will begin? And many of you were answering this. There will be formation of myelin figures. Now, guys, there are three questions of myelin figures that you get in the exam, right? Three questions of myelin figure. What are those? Number one, what injury do you see myelin figure in? Let me give you options. Let me give you options. Myelin figures are seen in reversible cell injury, irreversible cell injury, or both. What is your response to that? Reversible cell injury, irreversible cell injury, or both? Excellent. They are seen in both, but let me tell you how the examiner will put the question to you. In reversible cell injury, their formation begins, like I just told you over here. In irreversible cell injury, the number of the myelin figures will increase. For example, just as a hypothetical situation, if the number of myelin figures in reversible cell injury was 5, the number of myelin figures in irreversible cell injury will become 50. So please remember they are seen in both these cell injuries, not in any one. They are seen in both. What is the next question that you will get? You will get the question on composition. What are these myelin figures made up of? What are myelin figures made up of? Anyone who wants to give that a try? Excellent. So all of you mentioned phospholipid, but guys, firstly, let me tell you as we proceed, in order to save time, when you're answering, you can even give me short forms or initials, so that you can also save out on your time. Meanwhile, you can write, and at the same time, you can answer as well. Okay, so when I say what is the composition, yes, perfectly, Dr. Rahul. So composition is just not phospholipid. It is just not phospholipid, but something along with it, that is calcium. So it is a combination of phospholipid and calcium. That's question number 2 that you get. And third question, I'm going to introduce you to the very first image in pathology, the image of a myelin figure. So the first picture that you have in Path is this image. Like I told you, all of you can download the PDF, you'll get the images there. So the when I started Path, I told you it's a world of colors. It's a lot of pink and blue, but the very first picture that I've shown you in Path is a black and white picture. What happens when you see a black and white picture in pathology? It is electron microscopy. I'm dealing with an electron microscopy. So this black and white picture should hint you towards that. So I'll show you a lot of black and white pictures in the subject and you will know that I'm talking about EM. EM I'll write for electron microscopy. So look what you see out here. Out here you see there's this big structure and if you see it appears as if there's one layer on top of another, as if something is wrapping. Like if I have to draw it out, one layer is wrapping on top of another. You call those concentric lamellations. So if someone asks you how does a myelin figure appear on microscope, so under the microscope, under an electron microscope, it shows concentric lamellations. Is this clear with everyone? We finished with the first part of that flow chart. I want to take you guys back to that flow chart where I told you I'll be covering three aspects. When there is a loss of ATP, you've done the first aspect, failure of the sodium potassium ATPase pump, right? Now let's go on to the second part of that flowchart. Second part of that flowchart. And now I'm going to target another thing. So the pump has failed. The pump has failed. The second part of the flowchart is anaerobic glycolysis. Anaerobic glycolysis. So what do you have to know for anaerobic glycolysis? Why did this happen? Remember, we are in a hypoxic state, less of oxygen. Obviously, in the absence of oxygen, the type of glycolysis will be anaerobic glycolysis. Agreed? Can anyone recall from biochemistry that one of the byproducts of anaerobic glycolysis was lactic acid? One of the byproducts, yes, Dr. Chintu, it was lactic acid, which basically means I have decreased the pH of the body, which basically means I have decreased the pH. And please remember, when we decrease the pH, there is something happening known as nuclear chromatin clumping. Nuclear chromatin clumping. Yes, Dr. Aditi, I'll just repeat that slide. Just give me a moment. So what is happening when there is a decrease in the oxygen, anaerobic glycolysis happens, which means pH of the body will go down. And when the pH goes down, the nucleus is hit very badly. The nucleus is affected. There is nuclear chromatin clumping. So guys, when you were targeting the pump, when the sodium potassium ATPase pump failed, you had things like myelin figures. You had things like myelin figures. Now, when your anaerobic glycolysis is happening, your nucleus is also affected. And number three, what is the structure that which organelle have I drawn of a cell over here? What is this organelle that I've drawn? ER, endoplasmic reticulum, and yes, to be more precise, rough endoplasmic reticulum. Rough endoplasmic reticulum. So that's the third thing in the flowchart that is getting affected. See, do you notice the rough endoplasmic reticulum is rough because it has ribosomes attached to it? Because it has ribosomes attached to it. Now what happens when a lot of injury is happening in your body? Oxygen is less, ATP is less. These ribosomes, they get detached. These ribosomes get detached. Now, what is this RER responsible for? What is it doing for our body? Yes, you are right. It is causing protein synthesis. So, can I say if the ribosomes get detached, there will be a decrease in the protein synthesis? There will be a decrease in the protein synthesis. Everyone agrees with that? So finally, the three parts of your flowchart are done. Number one, you damaged the sodium potassium ATPase pump. So because of that, you had stuff like myelin figures. Myelin figures, what was it made up of? You guys told me it was made up of phospholipid as well as calcium, right? So that was damaged. Next, anaerobic glycolysis, you damaged the nucleus. Third, rough endoplasmic reticulum damaged, you have targeted the proteins. Can I say roughly everything of a cell is damaged? Phospholipid is damaged, nucleus is damaged, protein is damaged. Cell injury, that is what you're talking about. But all of this was reversible cell injury. Till this point, if the patient is brought to the hospital, given adequate treatment, all the things are sorted, everything will get back to normal, reversible. Problem is when patient is not given treatment, what will he enter into? Irreversible cell injury. So if he is not given any treatment, he will now progress to irreversible. Before I come to that, Dr. Aditi, you had asked a repetition of the slide of myelin figures. This is how it looks like. Myelin figure, black and white picture. This is an electron microscopy, and you see one or the other thing wrapping over the other. So that is concentric lamellations, right? Okay, so no, we've still not reached necrosis. Please wait for that. We have just reached reversible, we finished. Now we've reached irreversible cell injury. Okay, so can anyone tell me at what point do I define? What point do I define that, okay, now the injury from reversible has become irreversible? At what point? Okay, so Dr. Dharuni says the cell membrane gets ruptured. Cell membrane gets ruptured. Anyone else who wants to add on something to that? I agree, membrane rupture. Meanwhile, I want to address to some doubts. Dr. Nagul, you say myelin. What does myelin mean? Why am I calling it myelin figures? It has nothing to do with nerves. It has nothing to do with nerves. Myelin, because the way all the neurons are surrounded by myelin, right? How is myelin? One layer on top of another layer on top of another layer. That is how myelin is deposited in the neurons. Here also, did you notice there is one layer on top of another, concentric layers? So basically, that was just a similarity, that how it is laying down, but it has nothing to do with neurons out here. Okay. Moving on, yes, all of you told me correctly. I say reversible to irreversible happens on two things, two phases. Number one, you guys told me correctly, severe membrane damage. The membrane has been ruptured, severe membrane damage. And number two, severe mitochondrial damage. Severe mitochondrial damage. Guys, let me tell you one trick for this chapter. The trick for this chapter is mitochondria. Whenever I ask you XYZ scenario is happening in which organelle, the organelle of this chapter is mitochondria. So remember the first question I asked you, what is the first change of cell injury? Which organelle gets affected first in cell injury? Your answer was mitochondrial dysfunction. Now I'm asking you, which organelle will get damaged and we will go from reversible to irreversible? Mitochondria. So anywhere I ask you question about organelle in this chapter, your answer is blindly answer mitochondria. So that is your trick for this chapter. Okay. Moving on, severe membrane damage, severe mitochondrial damage. That is when I say we've entered irreversible. So let's take this up with the help of a diagram. Let me draw this diagram. This is a cell, and all of you told me the first change is membrane has been damaged, severe membrane damage. When membrane gets damaged, what is the first thing to enter into a cell? What is the first thing to enter into a cell? Anyone who wants to answer that? Excellent. Calcium. Calcium is